So it's my absolute pleasure to introduce our keynote speaker today, Cecile Richards. Writing a brief bio on her is actually pretty challenging because of how much she has accomplished in her career. Cecile is a national leader for women's rights and social and economic justice and a co-founder of Supermajority, an organization staunchly advocating and fighting for gender equity. She's the author of the New York Times bestseller, Make Trouble, a memoir and a call to arms for the critical role that activism plays in our society. And as president of Planned Parenthood Federation of America and Planned Parenthood Action Fund for 12 years, Richards worked to increase affordable access to reproductive health care and to build a healthier and safer world for women and young people during a pivotal and critical political time. After starting her career as a labor organizer working with women earning the minimum wage, she went on to start her own grassroots organizations and later served as the deputy chief of staff to House Democratic leader Nancy Pelosi. She's been honored numerous times, including multiple Times Magazine's 100 Most Influential People of the Year. I'm most excited about her presence today because it highlights how championing child mental health demands us not to look at children in isolation, but in the context of the families that care for them and the women who bring them into the world and shepherd them through it. So please join me in welcoming Cecile.
That's what I'm hoping. Cool. I hope not. I think we're okay. Bear with me a moment here.
Just flip the power to.
Huh?
Sorry.
No, it's okay. I was just gonna.
We gave you power already.
Oh, you did? Okay.
Yeah.
Oh,
Yeah.
awesome. Okay. Not my expertise. How's everybody? I think I'm what's standing between you and drinks, so I recognize my responsibility here. Can I close this? Do you know this laptop that's up here? It's okay? Okay, cool. Thank you. Listen, it's an honor to be here. I've never been to MIT in my life. I'm not a scientist. I'm not a doctor. It's just humbling, and even getting to hear the presentations that I've just heard. I really want to thank Barbara Picower, the JPB Foundation, for the support of such important work, both at MIT, the Picower Institute. Thank you for the life-saving research and work that you all do every single day. So I spent my life actually as an advocate and an organizer and sort of I always say in Texas, a shit disturber. And a lot of that has really been focused on women's health and rights. So this isn't my usual venue, but I think most of us could agree, and I saw some kind of thematics in the presentations that I was able to listen to, that when women have access to health care, to economic opportunity, to their rights, they impact not only their own lives, but the lives of their families, their communities, their countries, and the world. So I guess I kind of feel like our two worlds perhaps have collided a little bit in these last few years, because I think when facts and medicine are treated with hostility or suspicion or disbelief, the impact is widespread. And of course, the entire country got a little taste of this during the COVID pandemic, when suddenly everything from wearing a mask to getting vaccinated became a political issue. And of course, I learned this during my many years at Planned Parenthood, an organization that had worked for more than 100 years to increase and improve access to reproductive health care, that we were constantly doing things to advance new technologies and new reproductive medicine. I remember how excited I was when we did the clinical trials for a self-injectable birth control, which really just can radically change opportunities to have good family planning access. Everything from that to the morning after pill, but every single advance we made seemed like it ran headlong into some kind of political fight. And I think what's happened in the last 12 months, which is what I'm going to talk about, has really put in stark relief kind of the the real danger and potential outcomes when people come between, that politics comes between people and their health care. So I'm going to do my dead level best to make this relevant to all of you. And so I appreciate your patience going into this because I think increasingly as researchers, as public health advocates, as doctors, as clinicians, you're going to find yourselves as well on the front lines advocating for the very life-saving work that you do. So let's get started. We'll start with last spring, when on June 24th, the Supreme Court of the United States handed down their decision in Dobbs versus Jackson Women's Health, overturning Roe versus Wade and ending 50 years of the right to abortion in the United States. And the country erupted. Over the next few days, there were rallies. And I'm not going to have a bunch of PowerPoints that explain things in graphs. I'm just going to have some images. So that's more my style. But anyway, over 400 or 600 rallies across the United States. It was what some reporters referred to as the Summer of Rage. And of course, it wasn't only here in the U.S., it was around the world. People took to the streets. Presidents, global health organizations, even the United Nations condemned the decision. And the Dobbs decision definitely has inflamed our country. And as it squarely put decisions about pregnancy and family, not in the hands of pregnant people, but in the hands of politicians. And I guess that's a point I really would like to underscore if you get nothing else from this conversation today. The Dobbs decision wasn't a reflection of where the country was on the topic of abortion. It's a deeply personal issue. It's one that people have very strong feelings about if they've ever had to deal with pregnancy, and most families have. The decision was actually about who has the right to decide, the person who's pregnant or the government. It's fundamentally, I think, a question of freedom. And what we've seen in the past year is the American people actually pretty squarely on the side of keeping government out of these decisions. But since last June, the loss of abortion rights has impacted families, people of every geography, age, race, and income. But as we know, and as I know was sort of presented in some of the previous, by the previous speakers, the loss of any healthcare access disproportionately falls most harshly on people with low incomes, people who are marginalized with the least access to medical care, and people who are already stigmatized by the healthcare systems. Depending on your race, on your gender, your country of origin, your immigration status, and certainly your sexual orientation, you experience healthcare in this country in a completely different way. I learned that so poignantly as we began to roll out transgender services at Planned Parenthood, meeting people who were driving across state lines just to access life-affirming care. And I think we're only beginning to understand the medical and societal impact of Dobbs as state after state now begin to pass abortion bans. But the impacts are clearly not only on the people seeking abortion, but also on their families and on their communities. And I think it will be decades before we can truly measure the impact on women and on children. So as I get into this, I'm not here to sugarcoat things. I think the situation is pretty grim across the country. But I also just want to say from the outset, if I were a betting person, my money would be on the millions of Americans who are actually speaking out from Kansas to Massachusetts, standing up and saying, this is not okay. This is not how we want this country to be. I think this year has been a brutal wake-up call with folks realizing that our rights were never given to us. We've had to work for every inch of progress that we've made, and that's how it's always been. But before we go to the current situation, I just wanted to talk a minute about maybe the bravery of the folks that came before us. And so first things first, I come from a long line of no-nonsense Texas women. My mom and her folks were, they were country people, I guess that's what you call them. They lived outside of Waco, Texas, in a tiny town called Lakeview, although as my mother often observed, there was no lake to view. And the story goes that my grandmother got pregnant, And of course, she was going to have the baby at home. They didn't have access to a hospital. They didn't have the money for a hospital. So when she went into labor with my mom, she had arranged for the neighbor woman to come over and cook supper for my grandfather, because of course it was unthinkable that he might prepare that meal himself. And apparently, though, the neighbor woman had no experience killing a chicken, and that's what my grandmother had planned for supper. And so my grandmother hoists herself up on one elbow in the birthing bed and wrung that chicken's neck. And that's how I like to think my mom came into this world. My mom and dad both went to Baylor University in Waco, which is a Baptist school, where she said everything was more fun because it was either against the rules or it was a sin. And I think that's how they became such troublemakers. My dad became a civil rights lawyer, still is, fighting for voting rights and equal education opportunities in Texas. And then meanwhile, my mom dove into politics, first running for local office. But just to put in perspective, like, women didn't run for office in those days. It was something of a novelty. In fact, in Texas, her own grandmother couldn't vote because under Texas law at the time, idiots, imbeciles, the insane, and women were prevented from this franchise. But we persevere, and Mom would go on, actually, to become the first woman elected in her own right governor of Texas. And I like that because that sort of, to me, just it puts in perspective. A lot of this is recent, right? A lot of this, and I think the churn we are seeing in this country politically is recent, as women have become more active in social life, and some people just don't like it. And so I learned from my parents early on that if you had the opportunity to do what you choose what you did with your life, which most people don't get to, you sure as heck better do something to make the world better. And I know if she were here today, she'd be in the streets along with a lot of other folks. But of course, that's what it took in the beginning, too. So if you look back, we'll just do a quick history lesson. 100 years ago, well, a little more than that, in October 1926, Margaret Sanger, who was a nurse, along with her sister Ethel, and a volunteer named Fania Mandel, opened the first birth control clinic in the country. And it was a storefront in Brooklyn, where for 10 cents you could get a pamphlet that just explained how to prevent another pregnancy. Information that was completely illegal at the time and would remain so for another 50 years. And from the first day, women lined up down the block, women with babies in strollers and babies on their arms, desperate to find out how to prevent another pregnancy. So as the story goes, 10 days later, an undercover cop posing as a mom busts Margaret, throws her in jail, where she teaches all of her fellow inmates about birth control. And that's how kind of the movement began. But since birth control was completely illegal, folks had to be really creative. And I was recently back home with the local Planned Parenthood leader, Ken Lambrecht. He's a friend of mine, and we stopped by the old Ripley shirt factory. So Katie Ripley was an early activist, and she was married to George Ripley, who was the president of the company, and she would send empty shirt boxes to New York City, wrapped as if they were orders, where women in New York would fill them with diaphragms and condoms and health education materials and mark them return to sender and send them back to Texas. Katie Ripley is just one example of the many, many folks in this underground movement that worked to get birth control to women, a movement I think she would be horrified to find folks having to recreate today. And then, of course, eventually Estelle Griswold in Connecticut decided that she wanted to go to jail, so she started providing birth control in the state of Connecticut, where it was also illegal. And her case went to the Supreme Court, which is the famous Griswold versus Connecticut, which legalized birth control for married couples in 1965. Okay, so this is not ancient history. I also just have to point out, though, that Justice Clarence Thomas, in his concurring opinion in the Dobbs decision, said we should really revisit the Griswold decision, along with the right of people to marry who they choose. But still, birth control became legal, but abortion was still illegal, and healthy women were dying in emergency rooms all across this country. And brave medical professionals, docs, clinicians, clergy members, and women organized to change the law, including a group called the Jane Collective, which you may have heard about. There's a great film that's just been made about it. It's found in the 1960s in Chicago. And it was an underground movement of women helping other women who published anonymous ads that simply said, pregnant and don't want to be, call Jane, along with a phone number. 7 leaders of the Jane Collective were arrested in 1972, but the case was delayed until Roe was decided. And then, of course, the Roe case was brought by a young Texas lawyer, Sarah Weddington, at 26 years old, the youngest person to argue and win a case before the Supreme Court. And not only did abortion become legal, it became one of the safest medical procedures in the country. The point being, none of these rights were given to us. They all came because people stood up and fought back. And even in the last few years, I don't know, some of you may remember the fight to pass the Affordable Care Act under President Obama. I mean, we were involved in so many knockdown, drag-out fights in that, but particularly one of the biggest fights was whether maternity benefits should be covered for women. And there was an infamous hearing during which one of the senators said that he didn't think that he was opposed to maternity benefits because he was never going to need them. Apparently, he was past his childbearing years. But anyway, at which point Senator Debbie Stabenow turned right back around and said, well, I bet your mother did. But brave women in Congress really led the fight to get that. And just to show that you can make change if you stick to it, before the Affordable Care Act, about 12% of health care plans on the individual market included maternity care. 12%. Today, every single insurance company, every single insurance plan is required to cover it. So you talk about things that make the difference in terms of maternal health and the well-being of children. So thanks to the Affordable Care Act, women can no longer be charged for more than men for the same health care coverage. They can't be denied insurance because they've had a C-section or a whole lot of other reasons. As we like to say, being a woman is no longer a pre-existing condition under the Affordable Care Act. But of course, there was also a big fight to get birth control, and I just have to mention this because there were a lot of battles, but Congress decided they would convene a panel of experts to discuss the matter. But the great thing is that none of the panelists actually used birth control because they were all men. This is just a thematic, and I could give you so many different examples, but people organized, grassroots organizers traveled to Washington, and one day my phone rang, and it was the White House asking if I could hold for the president, and I said, of course, and he said, Cecile, this is President Obama calling to say, we're going to announce today at the White House that from now on, everyone can get birth control covered under their insurance plan with no copay. And today, 62 million women receive that coverage. And the first year alone, women saved $1.4 billion on birth control. Just to put in perspective the barriers that people continue to face that are institutional to get basic reproductive care. And yet, over the past few years, we've had to protect that progress, and I'm going to spare you the details of Trump Care, which pretty much rolled it all back, but which was narrowly defeated by Congress. Of course, we may have to revisit that again, but now we have to work, of course, to restore our most fundamental rights. So let's talk about the Dobbs decision. This case originated in the state of Mississippi. Do we have any Southerners here? Yay. Thank you, my friend. I'm going to talk harshly about our part of the world, I'm afraid. So in the state of Mississippi, the legislature passed a 15-week abortion ban, which was clearly unconstitutional under Roe, because Roe allowed for abortion access until fetal viability, which typically between 24 and 28 weeks of pregnancy. The state of Mississippi, it's interesting, they argued that the reason that Roe should be overturned was, quote, there is simply no causal link between the availability of abortion and the capacity of women to participate in society. Their point was that access to abortion didn't make any difference to women. In fact, really, some of the oral arguments, like women were just doing so well in Mississippi, they didn't need this right anymore. So the argument wasn't about morality. Their point was something that actually could be objectively evaluated, and that is, did it in fact, access to abortion make any difference in the lives of women? And so in 2021, the Brookings Institute set out to answer just that. So they used very sophisticated economic data and methodology to isolate and measure the causal effects of abortion access on reproductive, social, and economic outcomes for women and families. And it may not surprise you, but the results were very conclusive that abortion access profoundly impacts women's lives by determining whether, when, and under what circumstances they become mothers. It impacts everything from education to economic progress, and to the point that this audience is particularly concerned with, it impacts the health and well-being of their children as well. Their study is comprehensive, but a few of the facts: access to legal abortion reduced the number of women who became teen mothers by 34%, and the number who were teen brides by 20%, and these results were even more impactful among women of color. Abortion legalization reduced maternal mortality among Black women by 30 to 40%. This, of course, was in large part due to the fact that for Black women, it was when abortion was illegal, it was much harder to find access to care or to get across state lines to a trusted healthcare provider. Something I would hazard is true, and we will increasingly see is true again now. Access to abortion is also directly related and linked to women's increased education, ability to participate in the workforce, and their earnings, and again, even more so for Black women. But this right didn't only impact women. It had profound effects on the circumstances for children. I found this really interesting. Legal abortion reduced cases of child abuse, child neglect, reduced the number of children who lived in poverty in America. And it improved the long-run outcomes for an entire generation of children by increasing the likelihood that they would attend college and reducing the likelihood of them living in poverty. The other important fact is abortion is not uncommon in the United States. In fact, 1 in 4 women will have an abortion in their lifetime. And in part of this is due to lack of sex education and a challenge for many people to get affordable birth control, despite a lot of the progress we've made. In many states, they don't teach sex education anymore, or it's only abstinence. And of course, this will not surprise you either, that the correlation between states that refuse to teach age-appropriate sex education completely track with states that have the highest rates of teen pregnancy. My home state of Texas is a very good example, where not only is sex education not required, but we top the nation in repeat births for teenagers. In other words, the same politicians that are voting to prohibit sex education are the ones that are also voting to outlaw birth control and abortion. And though we've made a lot of strides in birth control, access is still hard. I was reading a report by Power to Decide. It's an organization that advocates for better access. Reports that currently more than 19 million women of reproductive age are in need of publicly funded contraception, but don't have reasonable access to a health center that offers the full range of birth control. It's also worth understanding who has abortions in America, or at least did before the Dobbs decision. They are primarily adults. They are likely to be living with low incomes, and the vast majority are already parents, so they know full well what the responsibility is. And in the rush to force women to continue their pregnancies, there's very little conversation about just how expensive it is to be a mom in America. As I think you all know, the United States is still the only industrialized country without any required paid family leave. Access to affordable child care is a national crisis, partly because we don't fund it, partly because, of course, the people who do this work, caregiving work, are underpaid and overworked, and they're primarily women of color. On average, child care costs about $15,000 a year, and that's if you can find it. That's if you can actually find it. So if you're earning in this country, let's say twice the minimum wage, let's say $15 an hour, that means you would, if you're working full-time, you would earn $31,000 a year. In other words, half your income at least would go to child care. And that's assuming that you only have one child. I think for a good example of how impossible it is for moms with low incomes, we can go back to the state of Mississippi where this case began. Mississippi is arguably the poorest state in the country. 1 in 3 children live in poverty. 20% of people in the state live below the poverty line, but repeatedly the efforts to actually improve the situation for Mississippi residents are stopped by the legislature. Carol Burnett, I love that's her name, she's the executive director of the nonprofit Mississippi Low Income Child Care Initiative, says, "They're so determined about their anti-abortion stance, but there's no similar match to being concerned about children once they are here." In Mississippi, 8 out of 10 Black women in the state are heads of household. The state has the highest rate of infant mortality and twice the national average for maternal mortality. There's only abstinence, only education, no discussion of contraception, and the state has one of the highest teen pregnancy rates in the country. So you can kind of just see how this all is going. And yet the same state legislature that passed the abortion ban refused to expand health care coverage for new mothers on Medicaid. It was 2 months, and they refused to increase it to 12 months. I will say, finally this year, after massive political pressure, the state just expanded access for mother on Medicaid, finally. And the same patterns, they exist in state by state by state, so we won't go through them all. But I think it's also important to know that well before the Dobbs decision, the efforts of state legislatures to actually make abortion harder to access were in full gear. In fact, nearly 500 laws and regulations were passed in the last 10 years to limit abortion access in the United States, even though internationally it's recognized as a risk factor for maternal mortality. Last year, the Commonwealth Fund that works on health research determined that maternal death rates for American women were more than triple those for women in Germany, France, and the United Kingdom. Triple, okay? Just sit with that. They also concluded, and of course this is consistent in every research that you read, Black women in the US are 3 times more likely to die from pregnancy complications than white women. It is a national crisis. And then just confirm that your zip code is somewhat your destiny. According to the CDC, maternal death rates in Arkansas, Kentucky, Alabama, Tennessee, Louisiana, and Mississippi are the highest in the countries. And the one thing these states have in common is that they banned abortion along with Texas shortly after the Dobbs decision. I just think at a minimum, you could argue that if politicians were concerned about maternal mortality, there are better ways to address it than spending all their time restricting abortion access. The APHA actually looked also at specifically this link between maternal mortality rates and abortion restrictions. And their report, ironically, came out just before the Dobbs decision, but it studied all of these types of restrictions that were being passed in states and how they correlated. The findings were that many of the restrictions that were being passed in states like Texas correlated with increased maternal mortality. In particular, they isolated 2 policies that were incredibly challenging. One was the requirement that abortion care be provided by a doctor, which is not medically necessary and made it very difficult for people that lived in rural areas. And of course, the denial of Medicaid coverage for women for abortion had an enormous impact on people with low incomes. It also referenced growing evidence that links abortion restrictions to infant mortality, child homicide deaths, negative mental health outcomes among women who were denied abortions, and adverse birth outcomes. This is a lot of material here. And as we're now seeing increasingly in states that have banned abortions, women with chronic health conditions who are unable to access services are being forced to carry unwanted pregnancies to term, even if their health and lives are in danger. So I'm just going to give you one example. I'm living in Louisiana now, and there was a recent story about Caitlin Johnson. Sorry, let's see if I can get this to come back up. This is Caitlin Joshua, excuse me. So she and her husband were overjoyed. They already had a kid. She was pregnant with with their second child. But when she tried to get an appointment for prenatal care at 8 weeks, she was told that she would have to come, she couldn't come in for another month. And the woman on the phone explained that since a lot of women miscarry in the first 12 weeks of pregnancy, the clinic didn't want to risk being prosecuted under the state's abortion ban. So no prenatal care. And then actually she did begin miscarrying, but she was sent home from the emergency room, not once, but 2 different emergency rooms based on their fear of being charged with assisting in an abortion. And this is not uncommon. Afterwards, she explained to a reporter, "I love my kid, and so she constantly makes me want another. But it's just too dangerous to be pregnant in the state of Louisiana. I don't think it's worth risking your life for a baby right now." There's also evidence that women who are forced to remain pregnant are more likely to stay in unhealthy relationships, suffer mental health and physical health consequences, and live in poverty. The Turnaway study, which is probably the most important work that was done on this, which researched nearly 1,000 women for 5 years, found that those women who had been denied an abortion experienced worse economic and mental health outcomes than the cohorts that received care. Efforts by states to restrict abortion included everything, and I dealt with all of it at Planned Parenthood. State-mandated counseling, which was designed to dissuade women from choosing to end a pregnancy by forcing doctors to read things that were medically inaccurate, like that it would increase their rate of breast cancer or increase the rate of suicide. Our docs used to just say, "I'm now going to read you a pamphlet that the state makes me read, but it's completely untrue." But that's outrageous. That as a doc, you're forced, it's forced speech. Many states passed mandatory waiting periods, again, forcing women to come back multiple times in unnecessary ways. In fact, the North Carolina bill that just passed last week would require women to come back 3 times, 72 hours apart, which is impossible for most working women. In Texas, we were forced by the state to only provide abortions, back when we could, in ambulatory surgical centers, which are like mini hospitals, even though abortion is actually safer than getting your wisdom teeth removed. But the idea was to make it financially impossible for people to continue to provide care, and many providers did close. And I think that's the other sort of impact that is not studied or understood, is that when women's health centers close, and it affects so much more than abortion access. I remember a few years ago, we had to close in El Paso, the Planned Parenthood, which is a large city on the border. And when we finally did reopen a couple of years ago, one of the women who came in for her annual exam said, "I'm so glad you're back. I haven't seen a doctor since you all closed because I had nowhere else to go." Which is another impact of all this, is that the abortion bans are impacting the medical community. And the loss of OBGYNs is a national crisis. A New York Times story reported on the devastating impact of the Cleveland Clinic, the Department of Maternal Health Medicine, fetal medicine, which is set up to handle high-risk pregnancies and the dangers that accompany them. And Dr. Maeve Hopkins, who specializes in high-risk pregnancies, said, "I don't know an OBGYN in Ohio who isn't thinking of leaving the state." And I've spoken to so many doctors in Texas who are facing unbearable situations. An oncologist in Dallas told me it's impossible now to care for her patients who become pregnant because cancer treatment is a risk for the fetus, and continuing the pregnancy is a risk for the mother. So under Texas law, she can no longer counsel her patients and give them the best medical advice. Training of new doctors as well is going to be impacted, and the Journal of the American Medical Association reports that 45% of the accredited OBGYN programs, residency programs, are located in states that ban or severely restrict abortion. So current and future medical students in those states will not ever even be trained in abortion services. There's already a shortage of OBGYNs in America, and the Dobbs decision is just making it worse. As Katie McHugh, she's an Indiana-based OBGYN, said, "Physicians don't go to medical school and into the practice of medicine because we enjoy interfacing with a legal profession." The March of Dimes reports more than 2 million women of childbearing age live in maternity care deserts with no hospitals providing obstetric care obstetric providers, or birthing center. Of course, it's particularly acute in rural America and results in many people not getting prenatal care. And babies that are born in these deserts, care deserts, are more likely to be born premature or underweight. And moms without prenatal care are 3 to 4 more times likely to have a pregnancy-related death. It doesn't have to be this way, right? It didn't need to be this way. And all of this is to say that women and children are facing some tough times ahead. And so if our goal is to have healthy pregnancies and healthy babies and children growing up with equal opportunity, it's just time that we quit criminalizing doctors and criminalizing pregnant people in America. We need fully funded prenatal care. We need to prioritize OBGYNs and clinical providers of maternal health. We need postpartum care. We need early childhood education and affordable child care. And we need to finally address the immoral rate of maternal mortality in America, particularly among Black women. We know how to do this, right? That's the thing, it doesn't even require more medical inventions, it just has to be our priority. But there's a reason to be hopeful, and I think ways that we can work together to build for the future. So here's what makes me hopeful. Number one, over the 50 years since the Roe decision, the medical profession has completely changed, and doctors are on the front lines, and they are the fiercest advocates for their patients. Today, 85% of OBGYNs are women, right? And many are mothers themselves. I love this photo of, these are the mighty Nebraska OBGYNs who organized together to fight back against all the attacks on abortion in their state. In Texas this March, 5 women sued the state because they were denied care, including Amanda Zawoski, who's actually made national news. She went into septic shock before she was able to get treated, and they were joined by 2 Houston OBGYNs who joined the lawsuit, including Dr. Judy Levison. I just kind of love what she said. She said she joined the suit because she didn't have children to support, unlike most of the other doctors. She said, we need to stand up. And then there is Dr. Caitlin Bernard in Indiana. So when a 10-year-old girl who had survived sexual assault had to cross state lines in order to obtain a legal abortion, Dr. Bernard cared for her, and she spoke out about the crisis unfolding in the country. And even after she was harassed and targeted by anti-abortion activists and, of course, threatened by the Indiana Attorney General, she refused to be silenced. And in fact, she put on her lab coat, strapped her daughter into a baby carrier, and marched to the state capitol with her colleagues. I'm also hopeful because fundamentally, women's lives and expectations have changed dramatically since Roe. Birth control, legal abortion opened up a world of opportunities for women, making it easier to finish school, to pursue a career, become parents when they were ready and if they were ready. So today, women are more than half of undergraduate students in America. They are half the law and medical students. Women now earn the majority of master's and doctoral degrees in the United States, and women are even making gains in politics. So when Roe was decided, there were 15 women in Congress. 50 years later, that number is 147. We simply can't go back. And if there's one thing that spurs me on, it's that the world cannot afford to lose the gifts and brilliance of a new generation of women and girls, which is my other reason of feeling hopeful. And that is seeing young people standing up and speaking out. They're walking out of school to demand gun reform. They're voting in record numbers, and they're fighting so fiercely for their future. Right after the Texas abortion ban was passed, they asked me to come down and speak at a rally, and I did, of course, and as it is in Texas, it's hot, yet thousands of people showed up. And there were a lot of elected officials and a lot of important people there, but the person I remember best is Vienna. So at the time, Vienna was in 7th grade, but she was so upset about this abortion ban that she started organizing her middle school. And pretty soon then kids from other schools were calling her to get organizing tips to see what they could do. And that day, she brought a step stool to the Capitol so she could get to the microphone, and then she just fired up the crowd like nobody else. Vienna and I are now texting pals, I guess you'd say. And when the Dobbs decision came down, she wrote to me, "We need to do something big and loud and let everyone know we won't go down without a fight." And she's so right? We can't leave young people, this generation of young people, on their own to wage this fight. And I think that is, I suppose, what keeps me hopeful. That's the beauty of today, is that tomorrow we can get up and decide to change the world. My mom used to give a lot of advice. Most of it was unsolicited. But when folks really needed some, truth from Ann Richards about what to do with their life, she'd always say, you can go a lot of places, be a big deal, make a lot of money, but you never get the kind of gratification that you get when someone looks you in the eye and says, "Thank you for making my life better." And that's what you all are doing. After all, she would say, why should your life be just about you? I think this is a time not to ask for permission or wait for instructions from someone. We have never lived in times like these. Never. And we just have to do more. So organize your friends. Learn about what's happening. Have a speaker or invite a group that's on the ground to tell you what you can do. And men, this one's for you. We need you, right? We need you. In the same way that civil rights shouldn't fall on the shoulders of those without them, abortion rights can't be won by women alone. Seeing the pride that fathers have now for their daughters as athletes and valedictorians and sports stars and candidates even, it gives me a lot of hope. No father wants his daughter or his son to have their future destroyed by a politician. And so most importantly, I think, don't leave young people on their own. Support them. Show up for them, however you can. Maybe you're the trusted auntie at the other end of a text, right? who can just be there. Life has not changed that much for when we were young. It can be so scary, and a lot of folks feel on their own. Mentor young people. Offer to write them recommendations or introduce them or help them find a job or an internship. And when you see a young person, encourage them. Carry their step stool, or brainstorm with them about what they want to do. And most importantly, help them live their dreams. We owe that to them. There's never been a better time to be part of shaping the future. And take it from me, being part of this wild, crazy fight for social justice is not only important, it's incredibly joyful and rewarding, and you meet the most amazing people along the way. A few years ago, I had the honor of hearing Secretary of State Madeleine Albright speak at the White House. Of course, here's a woman who had not only served as Secretary of State, but also faced down dictators and fought for freedom around the world, right? So I just want to close with a favorite few lines that she spoke that night. This is from The Low Road by Marge Piercy. How can you stop them? Alone, you can fight, you can refuse, you can take what revenge you can, but they roll over you. But two people fighting together, back to back, can cut through a mob. A snake dancing file can break a cordon. Two people can keep each other sane, can give support, conviction, love, massage, hope, sex. Three people are a delegation, a committee, a wedge. With four, you can play bridge and you can start an organization. With six, you can rent a whole house, eat pie for dinner with no seconds, and hold a fundraising party. A dozen make a demonstration, 100 fill a hall. 1,000 have solidarity and their own newsletter. 10,000, power and your own paper. 100,000, your own media. 10 million, your own country. And it goes on, one at a time. It starts when you care to act. It starts when you do it again after they said no. It starts when you say we and know who you mean, and each day you mean one more. There's no doubt in my mind that we can build the kind of future that we need. We're bold enough, we're strong enough, and capable enough. So thank you for the life-saving research that you do, the contributions you are making to create a beautiful world. Thank you so much. Thank you. Take care.